For those of you that don't know me, I'm Jamie Mara.
And this is Lisa Hansen. We are running Sunday Clinic this year, and we thought a very short video orientation would be easier than trying to coordinate orientation in person. So bear with us as we try and make our first video. There are a few things we think you need to know. Number one, the population we are serving experiences a lot of barriers to care. They're unable to access transportation, have last-minute shift work, difficulty with childcare. In previous years, our patients have had a 40% failure rate, and that means we have to be super fluid in our clinic book. We're double booking every chair, knowing that nearly half of the patients won't make it to their appointments. We also have several final year students on standby, so we can open additional chairs should everyone miraculously show up at their scheduled times. Number two, a large proportion of our patients also have severe dental anxiety. Really avoid using language that implies bleeding or pain, and reassure patients that our number one job is their comfort. Number three, during our clinics, there are a lot of people involved, and each one of you plays a critical role. There will be lots of questions, especially on the first day. If you have a question, find one of us, Jamie or Lisa. If we aren't available, there are key floating DAs that are super knowledgeable and will probably be able to help you. Every volunteer in Sunday Clinic is doing less than their usual scope of practice. Dentists aren't offering fixed pros, dent techs are only able to offer one-step partials and relines, OHTs and hygienists are only scaling polishing, and students are doing the most important jobs. They're managing the patient movements, making relationships to build trust, and of course, changing oral hygiene and risky behaviors. Paperwork. Unfortunately, we haven't been able to get rid of all of it. The only piece that is critical, though, is this one, the Sunday Clinic enrollment form, not to be confused with the faculty enrollment form. This absolutely must be signed prior to x-rays, prior to seeing a dentist, prior to sitting in a dental chair. This document has a liability waiver that says no student, provider, institution, company, or otherwise is responsible to maintain, fix, complete, repair, replace, or on failure, etc. This is with regards to any care delivered at Sunday Clinic. It also contains blanket risking complications for our procedures. Now, dentists, feel free to reconsent patients as you see fit. However, this document should cover you for all work provided. Dentists, when you arrive, please enter at the main entrance off of Great King Street. Students will be there to greet you if you do not have card access to the building. Come up to the first floor and find a chair. Reception will be open by 9:45 and will be able to direct you to your chair. Open Titanium using the login details provided to you. Here's an example of a patient chart. You need to open a new treatment plan, research, it will always be blue. Then chart 990 and type in Sunday Clinic. The rest of your treatment plan should be organized by what the patient needs and how many appointments they can attend. For example, assume this patient can attend the first, third, and last Sundays only. At most, they could have 6 treatments, morning and afternoon sessions, max 3 hours each. If they need 4 extractions, a scale and polish, a restoration, and a one-step partial, try to organize that into 5 appointments. Appointment 1 would be at hygiene for a scale and polish. Appointment 2 would be with a dentist, preferably today for those exos. Appointment 3 would be for restorations. And appointment 4 would be in the CDT chair for impressions. And then appointment 5 would be with the one-step partial delivery on that last Sunday. Now I'll quickly show you how to chart for Sunday Clinic in Titanium. Once in the patient file, click on this icon to open a new treatment plan. We need to charge under Research, Payor, which is this blue tab. Okay, now back to the one I've already filled out. Next, we need to navigate to General Services 990 and add that to the base treatment, not within an appointment, but can be dragged all the way to the base treatment plan. And we've already got one, so we can delete this one. Now you can add appointments by right-clicking, Add Appointment, and you can enter in the services that you require, either preventive, restorative, or otherwise, into each of the appointments that you think the patient needs. Once you've completed this basic layout, this would be a good time to ask your DA or a student to find myself or Lisa so that we can discuss when we can slip the patient into appropriate slots for these appointments. You can see it's going to be tight and not everyone will get everything they need. Just do what you can. Lisa and I will be floating, one in clinic and one at reception. Please let us know if there are patients that you think need something more than basics, like surgical exo, one-step partial, endo, even a scale and polish, anything that's not to be delivered at the general dentist chair. You can ask your DA or one of the students to fetch us, or just leave a sticky note asking us to have a look at the patient chart. And that concludes the orientation for dentists, DAs, OHTs, and hygienists. Thank you so much for your time and commitment to help deliver Sunday Clinic. Can't wait to see you on Sunday. If you are a BDS 2 or 3 student or have been rostered as an OHA, please continue watching the last 2 minutes of this video. For BDS 2 and 3 students, your primary role is likely OHA, or Oral Health Ambassador. OHAs must meet and greet all the patients as they enter the building and manage their movements until they exit again. Check Titanium and find out the names of the patients in the chair you're assigned to. Job number 1 for OHAs is monitoring patient movements while in the dental school. Patients cannot leave the first floor reception area. Job number 2 for OHAs is the oral health passport. Every patient has an oral health passport, and it's the OHA's job to get as much of it filled out as possible. It's a great opportunity for you to work on your interpersonal skills as developing practitioners and to improve your oral hygiene promotion skills. Some tips: just be warm. Practice acceptance. Some patients will have mental health issues, difficulty with personal hygiene, and there's a lot of shame at the oral state that they are currently in. When discussing current oral health situation and solutions, be non-judgmental, make light of the action plan, but let patients know that everyone is more successful at setting and achieving goals when we write them down and commit to them. A little more about the oral health passport. The Sunday Clinic enrollment form must absolutely be signed and dated before any radiograph, scaling, treatments, anything, because it includes the waiver. Everyone should check that the waiver's been signed prior to providing any treatment, but it's primarily your job to tick it off and make sure it's actually been signed on the oral health passport. Please also make sure patients fill out enrollment forms and health questionnaire forms for the dental school if necessary. You can go to Titanium Documents tab and you'll see HQ and EF if the documents have been updated. Please ask patients who smoke or vape and tick if they would like cessation support. And if patients have no radiographs on file, please see the radiography lead and ask them to chart an OPG for the patient. Once patients have completed their dental appointment, please check that the dentist or DA has ticked the boxes as needed. You may like to introduce yourself to the dentist and DA when you bring the patient to the chair. You can point out the boxes on the passport and let them know to just make a few rough notes as they go for you at the end. At the end of the appointment, try to check these boxes, give a gentle reminder that you need to fill in that information, but if the dentist-DA pair is running late, just try and fill in the information later. Between Titanium notes and x-rays, you can fill in page 2. This is based on the ICCMS 4D system that you'll need to know by 4th year. This is great practice for you to look at patients' radiographs and notes to gauge their levels of decay, risk, progression, etc. Fill out this section because the dentist is unlikely to have time to do so. If you don't get it right, no worries. This is a tool to communicate with patients, not to plan treatments. OHAs are also the primary oral hygiene promoters. It might not be the most exciting part of dentistry, but it is the most important. If you get excited about it, your patients will too. Caries is the most common non-communicable disease, and it is completely preventable with some simple steps. Put on your teaching hat and use your own personal spin to help your patients change their behaviors. The third and last page of the Oral Health Passport is another communication tool, but importantly, this one is based on best clinical evidence for behavioral change. All of the ideas to improve oral health are optional and depend on each patient's habits and practices already in place. The only thing that has to be completed on page 3 is the dental clinic and phone number for a follow-up appointment in 6 months. And that's it. Thank you so much for your time, effort, and energy. I hope you get something out of Sunday Clinic, and at very least, you'll get a certificate for your volunteer efforts. We couldn't run Sunday Clinic without your help, so again, thank you, and can't wait to see you Sunday.